All right, great. Well, hello everyone, and welcome to the webinar Results-Based Accountability for IMLS and for the Catalyst Grants. It's a pleasure to be here. Again, I'm Dan Duncan, and I am a senior consultant with the Clear Impact, which is the firm that does results-based accountability consulting, as well as the results scorecard or the Clear Impact scorecard that I'll show you briefly. I'm also the connection with this. I'm currently the president of the board of the ABCD Institute and a longtime faculty member of the ABCD Institute. So as we get started to focus on the PowerPoint, I am going to turn off my camera now that you've seen me. And we'll get started with the webinar. And as I highlighted, please stop at any point and take your phone off of mute and ask me any questions you may have. I'll try to go through this fairly quickly. So what is results-based accountability? As I said at the conference, it was developed by Mark Friedman, who was the head of finance for the Health and Human Services Department for the state of Maryland. And he was frustrated because talk never got to action, data wasn't used effectively, and beautiful plans were developed, but they sat on shelves. So he developed RBA, and the values of RBA is a quick way to move from talk to action. But it's a simple process. It's a process that anybody can implement. It's based on common sense and plain language. We'll talk a little bit about language. It's not about big fancy reports, but really about moving from talk to action. And most importantly, we're finding that it's useful literally all over the world. Just a background on it, I first found out about RBA when he first announced it, kind of in 1999, and I was working at a United Way at the time, and I thought, wow, this is a wonderful way to do our work. So I helped 3 United Ways improve their work through the use of RBA over time. So I can highlight from personal experiences that it's a really helpful process for driving from talk to action and using data. So the RBA in a nutshell, as we call it, it's about 2 kinds of accountability, both population and performance, and I'll talk a little bit about that during the webinar. And then 3 kinds of performance measures. How much did we do? How well did we do it? And is anyone better off? And the answers to those questions can give you the information you need to improve. And the way you do the improvement is by using the 5 core questions to turn the curve. So it's about kind of using data and using turn the curve thinking, as we'll talk about today, to improve and develop action plans for improvement. And turn the curve thinking is based on, first of all, looking at how we're looking at the data, seeing how we're doing, and then what's the story behind the curve, what's the story behind the baseline? Why is it happening the way it is? What's working, what isn't working? Why aren't we where we want to be, or where are we wanting to be? And then who are our partners that have a role to play? As we begin to turn the curve and improve what we're doing, who are our partners that have a role to play? And this is an important point. The reason we ask this question here is because it helps to broaden the solution space for individuals and organizations to think broader than just themselves. And one of the unique features of the Catalyst grants is that they are about engaging the community, engaging new partners. And so RBA can actually help you do that, identify who could be some new partners we could bring around the table to be effective or more effective. Then the 4th question is what works to turn the curve? So brainstorming on what are the things that we could do to improve what we're doing? What could each partner do to improve what we're doing? And in turn the curve thinking, we're also very purposeful about engaging the community in this work. And I'll talk about that a little bit later. And then finally, what is our action plan to turn the curve? We brainstormed all these things. We've just come up with 20 things. We can't do them all immediately. So what can we do over the next 30, 60, 90 days to truly make a difference? So to give you an example of this, this is a little exercise that Mark Friedman developed to explain how RBA becomes very practical. And so this is the leaking roof exercise. So you notice that every time it rains, you've got water in your dining room. So the first thing you want to look at is this experience. I've got water in my dining room. And the next thing you want to do is identify data. So how could we measure how bad the roof is leaking, or how bad the leak is occurring in our house? And we may find a bucket. And so we can put a bucket down under the leak, and then we can measure actually how much water is coming into our house. It was cute. I was talking to doing this exercise, and one individual said, well, let's just measure the number of towels we need to clean up the mess. So again, another way of measuring that. But what we would do is measure that, the inches of water in the bucket. And then the question we ask ourselves, is this okay? Yes or no? Of course, it's not okay. So what we want to do is turn the curve. We actually want to reduce, in this case, so that there are no inches of water in the bucket. So now that we have data, we know what's going on, we can go to the story behind the baseline. Brainstorm all the potential causes of why we have water in the bucket. And as I've done this over the years, people have talked about, of course, leaks in the roof, the parapet wall is leaking, there's some animals have caused some problems in the attic. So we can brainstorm all the potential reasons, again, from bad roof, bad shingles, whatever that might be. And once we brainstorm all the potential causes, then we can talk about the potential partners to help us solve the problem. So it's a roofer, it's a plumber, it's a pest control person, it's a carpenter. So we brainstorm all these ideas. And also we may say, because we're talking to our Uncle Bill about it, and Uncle Bill says, hey, I know how to fix roofs. I'll come and do that for a 6-pack of beer. And so we've brainstormed all the partners, we've brainstormed all the things we need to do. We've got Bill will do it, or we've got a carpenter, a plumber, a roofer, and we may decide that the action plan is we'll go with Uncle Bill. So we work with Uncle Bill, he goes up and does what he thinks he can do to fix the roof, and then we measure it again. So we identify the next time it rains, put the bucket to see if there's still water in the bucket. And with Uncle Bill's solution, there very well may be water again in the bucket. So we can go back through the story behind the curve, the baseline again. What are all the other reasons did we miss anything? Again, talk about partners, what works. And at this point, we may decide to actually call a roofer or a plumber or a contractor to fix the roof. So that's a quick example in a real life of how story behind the curve and RBA can help you make decisions in your life. So the key though is, why turn the curve thinking? It's to move from talk to action. So we can fix the leaky roof, we can help more kids be successful and learn to read, whatever that issue may be. And so one of the things, though, we need to talk about as a starting point is one of the things Mark noticed, and I've certainly seen that in my career, is that a lot of times organizations, we're trying to work together, and we have to be very clear that organizations don't collaborate. People do within those organizations based on common purpose, relationships, and trust. And if we can't even speak the same language, it's very hard for us to build the relationships and the trust, because you've seen all of these words that are used a lot, and so we can talk about the measurable, urgent, systemic indicators. The problem is when we use this language without taking the time to create definitions and be very focused in our work, people don't know what's going on, and they can't even communicate. And in fact, one of the things that Mark likes to say, if people put 4 or more of these words in a sentence, it's probably pretty clear they actually don't even know what they're talking about. So we want to get away from the jargon and be very clear. So in RBA, as we've highlighted, it's a fairly simple process. So there are only 4 concepts and 4 terms that we need to define. And again, as I highlighted earlier, 2 levels of accountability, population and performance. At the population accountability level, at the work we're trying to do for the entire community, the entire area, the entire neighborhood, the 2 terms are result and indicator. A result is a condition of well-being for children, adults, families, or communities. It's that North Star that we're trying to achieve with our work. So children born healthy, children ready for school, safe communities. Now we need some data to help us know how we're doing. So at the population accountability level, we have an indicator. And an indicator is data, which is a measure which helps quantify the achievement of a result. The rate of low birth weight babies, percent of kids ready for kindergarten, the crime rate, the air quality index. So those are the population accountability, result, and indicator. At the performance accountability level, we have two terms. The first one is a program. And what we mean by that is a program, an agency, a strategy, or a service system. So that's the actual work we're doing in the community with people, with customers, with clients, with ourselves, whatever you may call that, but that is the work we're actually doing. So the library, a nonprofit, an early childhood system, whatever that may be. And then the data at this level we call performance measures, which is a measure of how well a program, an agency, or a service system is working. And this is where we're actually working with, again, clients, customers, working with people, and we have a larger level of control. And so the three types of information we need is things that tell us how much did we do, how well did we do it, and is anyone better off? So I will spend a few minutes kind of drilling down to these a little more, but I just wanted to set the stage that it's important that we have these four key concepts and the definitions and the key terms. Now you can change these terms. You can call, in fact, RBA in the UK and in the United Kingdom is actually called OBA. So results are called outcomes in the UK. So it's not, you can have any terms for these words that you want. It's just important that you have the four concepts defined and everyone around the table agrees to these definitions. So just give you a quick example. A safe community, kind of guess among yourselves what you think that is. That is clearly a result. The crime rate is an indicator because that is a population level data source. The average police response time is a performance measure because that's about something that the police department is actually doing, that they have some level of control. People have living wage jobs and income. At the community level, that's a result because we're looking at census data or something that tells us the number of people in the community that have living wage jobs and income. The adult literacy rate, also an indicator because that's a community level data. A social service department is a program, and the percent of people with a living wage job and income, if they are at the community level, that's an indicator, as you can see, because we're talking about the percent of people in the community that have living wage jobs. But if we talk about the percent of participants in a job training program who get living wage jobs, that's a performance measure. So that's kind of the distinctions between results, indicators, programs, and performance measures. So as I highlighted, two kinds of accountability, population and performance. The other way to think about it, we've got the entire population in a community, in a state, in a county, in a city, in a neighborhood, whatever that population geographic area that you define, that's the whole population. And then the performance accountability focuses on the client population, the people we're actually serving with our programs, our activities, or our strategies. The other way to think about it is the whole population is the end result we're trying to achieve for the entire community, all kids, successful school life and work, families successful, whatever that may be. And the means are all the programs and activities that we're doing to help achieve that end. So population accountability results, again, conditions of well-being, and it should be in common language that people understand. It passes what we call the town square test, that people clearly understand that North Star we're trying to address as we move forward. So residents with good jobs, children ready for school, a safe and clean neighborhood. And the indicators, as I highlighted, are collected from community level data sources. So high school graduation rate, percent of children performing at grade level, overall attendance result or rate for a school. So it is an indicator, but indicator data is collected at community level data sources. So the census, the State Department of Education, the State Health Department, neighborhood surveys, whatever that may be. Indicator data is not collected from agency program data. It's not rolling up program data to create indicator data. You need to get indicator data from community level sources. Now, performance accountability, because most of your work, if you use RBA, is really around the performance accountability. What can we do to improve what we're actually doing on the ground with our customers, with our clients, whatever that may be. And so the matrix to help us do that is quantity and quality on the top, and effort and effect. So how much did we do? What's the quality of what we did? How hard are we trying? And what is the effect of what we're doing? And so how much service did we deliver? How did we deliver it? What change did we produce? So as a United Way professional, I literally would just come and sit down with an agency with this one chart and go through it. And we were able to identify the performance measures that any agency or program needed to improve what they were doing. So the upper left-hand quadrant is how much did we do? So number of customers served, number of activities, that's how productive we are. It's important, not the most important, but we need to know that for budgeting and planning. Are we going to serve 200 kids or 500 kids? Different budget, different perspective. So that's important to know. The upper right-hand corner, how well did we do it? Customer satisfaction, retention rates, following protocols. That's about, are we doing things right? So customer satisfaction, if we want people to stay involved, we ought to at least find out whether we're treating them well and we're giving them something of value. Are we following our protocols? But I think the most important one is really retention rates. Are people staying in the program, staying in the activity long enough to get the benefit of the program? Because it doesn't matter how good the program is if people aren't getting the dose, if they're not staying in the program long enough. And if we have that information, we can turn the curve thinking to identify how can we change what we're doing so people stay in the program longer. Because if we don't do that, we're really kind of spinning our wheels. So retention rate. So if you have a parent education program that meets for 10 weeks, and if you find out that most of the folks, half the folks are dropping out before the end of the full 10 weeks, find out why. What do we need to change? Do we need to change the location? Do we need to provide childcare? Do we need to have it bilingual? Whatever that is, if we have that information in real time, we can make the mid-course corrections that are necessary to truly improve what we're trying to do. But the most important ones are the ones in the bottom, which is highlighting, is anyone better off, which tells us, are we doing the right things? Because everything we do, every activity, every one of your grants that you're funding, all of your activities are designed around changing skill, knowledge, attitude, opinion, behavior, circumstance, or condition for the people we serve. And those are all measurable. Are kids learning new skills? Are they learning new knowledge? Is somebody that's homeless, are they no longer homeless? If somebody was unemployed, are they now employed? If they were having a health issue, are they now in better health space, if you will? And data can tell us what's going on. So again, we can make those mid-course corrections and find out what we need to do to improve. So quick examples, we have education. How much did we do? The number of students. How well did we do it? The student-teacher ratio. Is anyone better off? The number of high school graduates, the percent of high school graduates in our program. Here's kind of a fun one, fire departments. Certainly the number of responses, the response time, how well do we do it? That's something that fire departments can respond to. And then one of their key is anyone better off measures, performance measures that they use is the number and percent of fires kept to room of origin, because that really tells a good indication of how fast they were able to put out the fire. So that's a good example of that. So just to give you a quick example, I was working with this childcare agency, and I sat down with them to come up with their performance measures. And one of the things I asked them, what are some things that's unique about your program? Because they were saying, how could we have performance measures? We provide infant childcare. We're serving infants. And what do we want to measure? How soon they turn over at 2 months or 3 months in the crib, because they spend most of the times in their crib. And I said, well, what else do? You must do some other things that you're really proud of that makes your program unique. And one of the things they highlighted was that one of the things we do is that we administer something called the Denver test to see if there's any potential early developmental delays. And if it looks like there may be some developmental delays with the infants, they tell the parents that they need to get some additional testing and consultation. So they need to go see a pediatrician. They need to see somebody that could help them address these issues. And I said, that's great, that's wonderful. How are you tracking whether the parents actually follow up and get that additional consultation? And they said, well, we don't do that. Why would we do that? And I said, well, you want to do that to see if the way you're doing it works and is actually helping people to get that additional consultation. Because if they're not following up, then you're really wasting your time spinning your wheels providing that test. So because if you test that and check that out and find out that 80% or so of the parents are probably following up, then you're probably doing it pretty well. You can just fine tune it a bit to get to a higher percentage. But if you find that only 40% of the parents are following up, that tells you that you probably haven't identified all the barriers and all the issues that are getting in the way from them doing that. So it really makes sense for you to, then you can change. Why are they not following up? And so you may decide you need to bring a pediatrician to the child care center for consultation rather than having people trying to follow up themselves with their busy lives. So that's just a quick example from my experience of how agencies and organizations can use this information to actually improve in what they're doing. So the other thing is when you're doing performance measures is you want to make sure that you are kind of not getting too many. So because if you have too many, it's too hard to keep track of that. So what you want to define are what we call headline performance measures. Those performance measures that meet the public square test and give you the best information. And then you also want to have some secondary performance measures, all the rest of them. So maybe you brainstorm, you came up with 10. So we want to get down to 3 to 5 headline indicators so that you can really focus on those, communicate those, and then everything else is there as secondary performance measures. And then you also may identify a data development agenda. This would be a really good performance measure to know, but we don't have that data right now. We need to have a committee to come up with how do we collect that data. So again, in that example of the child care center, you may need a committee to come up with the survey that you're going to provide to the parents to see if they did in fact follow up. The other thing I want to highlight with performance measures is it's important to set targets so that you can really turn the curve thinking around what's the gap between where we want to be and what our target is. So our target is having 95% of the participants attend the session. So if we're not at 95, what do we need to do to kind of close that gap as we do that? And when you set performance measures, I really recommend that you don't set them at 100% because something's going to happen to somebody somewhere. So 100% goals are not very realistic. Also, you want to make sure that they're based on reality, based on past experience. And as you learn more, you can always modify your targets based on your actual experience in the work you're doing. But one of the things I wanted to highlight is some examples based on some public libraries that are using RBA and are using the Clear Impact Scorecard that I'm going to show you in a few minutes. So here's an example of all children will experience a learning-filled summer. And so the indicator is the percent of kindergarten through grade 3 who are proficient at year end versus the beginning of the following school year. So they're looking at all kids and what did they lose over the summer. And they have a program, the library summer reading program. So they're tracking the number of registered participants, the number of programs and events, which are how much, the number of program event attendees, which is kind of a how well measure or a how much measure, and then the number of minutes read in the summer reading program as another indicator of kind of better off. Here's another one, the Flint Public Library, their youth literacy program, Read While You Wait program, and they're tracking how much, number of read while you wait library sites, how much, number of kids reading, how well, percent of sites reporting that staff have heard positive feedback from users. So again, customer satisfaction, and better off, the percent of sites reporting that the library is having a positive impact on the kids. And another one is here's another one, which is the Roanoke Public Libraries, children and families utilizing library materials, juvenile book circulation, juvenile library card signups. The children and family attend library programs, tracking the number of programs, the number of kids, and children participate in the library summer reading program. Number of summer reading program events, adults and juveniles, and the summer reading program attendees, and the number of feed and read meals served. So again, they were looking at some key programs that they could track around this work. So one of the things I wanted to highlight that's important as we begin to think about population versus performance, that end result we're trying to achieve versus the means, is that we got to be very clear that this is about aligning all of our activities and not cause and effect. Because two lessons around population, turning a population curve, is that it takes many aligned programs or activities to turn a curve at a community level. If we want to make sure that all kids in the community don't lose their knowledge during the summer, if you will, one program can't do that alone. It takes partners, it takes a whole host of activities. So it takes many aligned programs and activities, and you cannot prove causality of any one program to turn a population curve. All you can prove is or demonstrate is a contributory relationship because of an alignment of measures and because everybody around the table is taking appropriate responsibilities to do their role. So here's a quick example of that. This was actually a slide that was developed by one of my clients a couple of years ago, and they were highlighting that to turn a population curve at the community level, it takes a lot of folks pulling on that curve. It's a heavy curve. So it takes programs, it takes partners, it takes strategies, it takes public policy, it takes media, it takes a whole host of activities to truly help us do that in the work we do. So let's now drill down and really talk a little bit more about turn the curve and performance accountability. But before I do, any questions? Okay, so jumping forward again, turn the curve, just to drill down, because this is really the essence of RBA. It's not just about data, but it's how we can use data and information to make mid-course corrections and improve what we're doing. So it starts with how we're doing. So we look at the data and we look at the history of what we've been doing. So if we're tracking, if this is the dropout rate in our high schools in our community, if it's an indicator, or the dropout rate for the kids in our program, if it's a performance measure, we have a history and then we have a forecast. And the forecast is based on the history. So if it's been going up, we would assume that it's going to continue on the same trajectory. So again, our question, as we did with the leaky roof exercise, is that okay? Is it okay that more kids are dropping out? Of course, the answer to that is no. So what we want to do is turn the curve. So the first thing we need to do is look at the story behind the curve, identify the root causes of why kids are dropping out, all the potential reasons they're dropping out for school, but also look at the contributing factors. Why are they staying in school? Because in some communities, dropping out is the expected result. So we also want to look at why are kids staying in school? What are those kids that are staying in school? What's the contributing factors to that? What are the bright spots that are helping them do that? So you can disaggregate the data, and I'll talk about that in a few minutes. Look at demographic factors, cyclical factors. You can bullet point, prioritize, so you have a clear understanding of what are the issues that are causing kids to drop out or causing kids to stay in school that we could build on in our action planning to do something. Then the next one, who are our partners that have a role to play? talking about funders, governmental entities, businesses, the faith community, neighbors and families, community partners. And when you brainstorm who are our partners, it's important to be as specific as possible, not just say the business community or the faith community or the educational community, but which business, which church or synagogue or mosque, what schools could we engage? Because if we're going to move from talk to action, we actually want to be able to say who can call Reverend Smith or who can call the owner of this other business to get them involved. So we want to be as specific as possible when you're listing partners. And when you list your partners, you can also jump back to the next one, which is what works. So what is that partner going to do? But when you brainstorm this initial what works, it really is a brainstorm. So evidence-based practices, promising practices. Mark talks about low cost and no cost solutions. I think this is really critical to think about what can we start without a grant? How can we just do things differently? But also this is the space for the role of clients, students, neighborhood residents, neighbors, whoever that may be. This is where we bring in ABCD, and that direct connection between RBA and ABCD is at the low cost, no cost space. So being very clear about the role of community, the role of residents. What can people do by themselves, for themselves? What do they need a little help doing? And what are those things that only institutions can do? And also off the wall ideas. Brainstorm, because in a off the wall idea, there may be a kernel of an idea that really leads to some good action. So again, what works? Brainstorming all of the things potentially you could do. And then what is your action plan? What do we propose to do over the next 30, 60, 90 days to improve what we're doing? And when you do action plan, be specific. Who, what, by when? So Bill's going to call the minister to get involved, and he needs to have that done within the next 2 weeks so that we can improve our accountability, kind of calling these action steps or action commitments, so that we are truly moving from talk to action. So that is a brief kind of overview of results-based accountability. Now I'm going to show you a bit of the Clear Impact Scorecard, which is a tool that can help you track this data and use this information. But before I jump into the scorecard, again, are there any questions or thoughts about RBA? Any kind of reactions to it? We've got a little bit of time, so any comments, thoughts about RBA as I've presented it? Again, please feel free to take your phone off mute and let me know.
Oh, Dan, Eli's writing in the chat. He says, my mic isn't working. I'd be interested in hearing more about where RBA and ABCD align.
Okay, great. Well, I think where it aligns is really in a couple places. The first place in identifying the population results that we're trying to achieve, because the population results really ought to be about the hopes and dreams of the people that we serve, the hopes and dreams of people in a community. They shouldn't be just driven by professionals, and the result is never just a better service system, but it's really about the hopes and dreams, the lives that people live in a community. So the first place to engage ABCD is how do we bring the residents, the community around the table to help provide input, to help us decide on what are those population level results that we want to work on. And the second place where ABCD then comes into play is when we are developing effective strategies, because we cannot get to the results we want by just creating better service systems or just helping more people be clients or better clients. It really takes their role as what we call in ABCD co-producers of their own and their community's well-being. So one of our roles is to really help do that. The one story I like to tell is to kind of make this point is if we think about the work we do as a relay race, and we're trying to really create this North Star, the focus, the goal, the result we're working on in our community. If you think about that as a marathon, And a marathon is a very long race, 26.2 miles. And if the only people running in the race are the professionals, the agencies, the service systems, government employees, and the community is all waiting at the finish line for the professionals to come across the finish line and save us and make us all better. Guess what? The community's been waiting there a long time. This race can never get done at the level that it needs to. Professionals running in the race, they take a wrong turn, they run out of energy, they lose a grant at some point along the marathon. So we have to purposely turn the marathon into a relay race. Turn it into a relay race where both the professionals and the community are running in the race together. And the professionals hand the baton to people to do those things they can do themselves. In fact, in some cases, things only they can do. And the community passes the baton back to the professionals to do those things, but doing those things only, doing the things that only they can do. So for example, if I break my leg, I want to go to a professional to have a doctor set my leg. If I want to learn about nutrition, there's somebody in my neighborhood that knows more about nutrition than my doctor does. So how do we unlock all of that so that we can work together to be successful? So that in many cases, the role of the professional in ABCD and through RBA in no-cost solutions is really about, as professionals, how do we lead by stepping back? How do we create space for the community to do those things that only they can do? If we always do them for them, they never have that space to do it. And then what we often do is we confuse lack of opportunity with lack of ability. We assume people can't do things, but we've never given them a chance to do it. So that's kind of the intersection of RBA and ABCD, is really how we can work together to make sure that we're using all the solutions and all the action steps that we have available. Hope that helps. Any other questions or thoughts? Okay, so let me now move to the Clear Impact Scorecard. And this is a scorecard. Just put the logo there so you could see that you can personalize this. This is a web-based system that is designed to support the results and performance measures and the data we need. So here's a quick example of this that I developed. So we've got the children successful in school and life. And we've got the indicator of the percent reading at grade level in 3rd grade. And so if we look at this, you can kind of see the data. And as I highlighted, it's about looking at trends and looking at the trend line around this work. So if we went into what we call the turn the curve view in the scorecard. So we go to the turn the curve view in the scorecard. So we've got the data. We can actually edit a forecast. So we can assume that if we keep doing nothing, it's going to continue like that, which in this case is a good thing. But what we actually want to do is accelerate it. So we can kind of set that as our kind of forecast goal, if you will. And then we can go through the turn the curve thinking. And in the scorecard, you can actually put this up on the wall at a meeting, or you can have folks remotely joining, and literally create boxes here where we can turn this into kind of a Word document. In fact, if anybody wants to kind of, because we've got a few people around the room, kind of want to take your, if anybody wants to take your phone off of mute and highlight, what do you think are some factors that are contributing to percent of kids reading at grade level? Kind of, it looks like it's increasing, but just a little bit. Any thoughts? So again, you could go parent involvement. Sorry, you'd have to put up with my typing. So parent, anybody, anything else? Any ideas?
I got one.
Okay, good.
How about programs in the school geared towards making reading fun?
Good. Yep. All right, so you again brainstorm all the potential things there, and then you can save this, and we go to the next one. Who are our partners? Again, do the same thing, save that. What works, brainstorm all of the potential things we could do, and then finally, what are the broad strategies at the results and indicator level that we want to implement? And at the, so you can then use this, and at the end, you can actually create a PDF file of it. So now you've created the notes from your meeting that you've just had with all of the information. Again, we're just in the interest of time, we didn't go through all of those because I want to have a little more fun with the next one. So now we can go. Again, the where it's a little more focused is the is a program and a performance measure. So parents and kids reading together is our program, and the number of families attending 5 or more sessions. And so we've got the number of families attending 5 or more sessions, and our goal was to have 55 families attend 5 or more sessions. And you'll notice in the last quarter that we actually went below our target. Our target was 55 and we're actually down to 48. So again, we can brainstorm, why are parents dropping out? So again, let's try that again. Why do you think some parents might be dropping out from the program? And families. Transportation, childcare.
They have inconsistent schedules.
Okay. Oops, if I could only type when people are watching me. Whoops, good. Okay, so again, saving that, going to the next one, who are our partners, who could help us, make sure that parents don't drop out of the classes, brainstorming what works, and the action plan. And at this point, at the action plan, because we're working on a performance level, you can actually assign people to do things. So we wanted to have food at the better food. So we want better food at the meeting. So and we're going to and we're going to assign that to somebody. So if they have an email or user in the system, they actually can be assigned this task. And there can be a start date and a deadline, and 0 complete yet, haven't started it yet. And when you save this, it actually sends an email to the person letting them know that after our meeting, you've been assigned to see if we can get some better food at our meeting so that folks can stay, and more folks will want to stay. So that's just a quick example of that and the use of the scorecard. The other thing you can do with the scorecard, with this information, is you can actually, if you have a story that you want to tell, going back to this information, you've got a more detailed story. Again, I'm just giving you kind of a simple example. But if you want, you can actually embed any of these scorecards on your own website, or you can send people a link. Here is the embed the iframe code to give to the web person at the organization, or you can give folks this link and just email people this link. And there it is as a link so they can see the information. It is totally interactive so that they can see what they've got. When you update it in the scorecard, automatically changes it here. So here is an example of embedding one on a website. This is Scope, which is an agency in Sarasota, Florida. And I was looking at because they share a lot of their scorecards on their website. And noticed one here, civic participation. They're tracking voter turnout and they're tracking libraries and the information about people, the number of people with library cards in the community. Kind of interesting. They were also tracking the, let's see, here is it? Oh, the percent of borrowers that are residents of the community, and you can actually track that compared to borrowers who are residents, percent of borrowers who are residents in Florida, but not in Sarasota. So again, you can look at this kind of information in any way that you want to get involved and help share your story of your work in the community. All right, now I wanted to show you kind of the next thing about the scorecard. One of the things that's important in this work is to look at our data through aggregated and disaggregated lenses, because we know, and this is certainly on our forefront of a lot of the work we do today, but it's really important to disaggregate data based on race, ethnicity, gender, etc. Because if we just focus on, this is an example, the percent of children reading at grade level, we could, in this community, well, we're making slow and steady progress. We're at about 68%, a little over 70%. So we could feel really good. But if you don't disaggregate the data, you may miss the real story, because when you do disaggregate the data, you find out that Hispanic kids, African American kids are not doing as well as white and Asian kids. So it becomes really important to do a turn the curve thinking exercise around what do we need to do to address some of the issues that African American Black kids are having in the community, Hispanic kids are having in the community as compared to white or others. So it's a good way to really use this to disaggregate data so that you can, in fact, identify the true story and develop action plans that are addressing some of the policies and some institutional racism, whatever that may be, that is truly getting in the way in the work we do. And the scorecard is designed to do that. So just again, wanted to give you a quick overview of RBA, a quick overview of the results scorecard, or excuse me, the Clear Impact Scorecard. If you are interested in more information, you can contact me and we can talk, but the key is what is helpful for you on the ground. And that's why we're providing this information, these tools that you could potentially utilize. Kind of interesting, one of the organizations that we work with that uses RBA in the scorecard, this is they're a Promise Neighborhoods community in the Mississippi Delta. And this is a quote about how this is real. RBA, the scorecard, has really helped them take their partners to a higher level of commitment and focus. Just a couple other things. If you're interested in finding out more about RBA, Mark's book that he wrote about 10 years ago is called Trying Hard is Not Good Enough. It's the overview of RBA. You can also go to clearimpact.com and listen to a longer video or longer DVD of Mark talking about it himself. You can download, listen to that for free, plus the results-based accountability guide, just a short 11-page overview of RBA, is also available for free from the Clear Impact website. So again, additional resources. And if you want to follow up and contact me, please feel free, dan@clearimpact.com, or my phone number, 512-788-8646. And we will also be making this PowerPoint available to everybody. Well, I want to thank you all for spending a bit of time with us today to learn more about RBA. So any thoughts? Did the webinar go well for you?
Will says very informative. Thank you, Dan.
Okay. All right. On that note, I want to thank everyone for joining us, and please follow up if you want any more information at dan@clearimpact.com. Thank you.
Thanks, everyone.